Thank you very much. It's really, I have to tell you, it's a major pleasure for me to be here, and it's an honor. And thank you for that introduction. It's the one my mother would have believed, my father would have loved to have heard. So, but just too bad they weren't around. But nonetheless, I'm thrilled to be here. It's been a long week. I've been on the road a lot now, and I apologize. My time with you is pretty brief. A couple things I want to share with you is, one, I'm a city boy, grew up in rural Queens, New York. How you doing? You want some water? You know, a cup of coffee? You know, it's a little different than the wonderful folks I got to meet the last couple of days here. I have to admit, as a quick sidebar, even though I'm not with you a lot of the time, how much I enjoy Grand Forks. I went down, I got dropped off by a taxi in front of Cabela's, and I was on my own. And on my own, I found this wonderful little gallery inside where the movie theater is. I've never seen a little art gallery inside of a movie theater. It was pretty cool. And Bob, who runs that place, I found some nice art from some local artists. I got a beautiful photograph I purchased there from a woman, Mary something, that was great. I then went on a little walk. I met Badman, David Badman, you know, Badman Galleries. You know, boy, this guy's talented. What a community guy. This guy's huge. And it was great. So I sunk some money in there. I'm part of the stimulus package for North Dakota. And then, but the coup de grace is I proceeded further down the street and found Widman's. See, you don't talk about these chocolate chippers outside of North Dakota, folks. And you know, I know about the sugar beets, and I know about the beautiful Red River Valley potatoes. Say that 5 times fast. And but nonetheless, Widmer's was quite an experience as well, and capped off with dinner at Sanders. So in a one day, I had my own little excursion enjoying Grand Forks. So thank you for letting me have the honor to be with you today. One disclaimer, I always say my remarks really may bear no relevance to the slides I show. And that's okay. I think I want to set the stage with you. I want to share some ideas with you. This is a keynote. This is not a panel where I'm going to go through fact after fact after, you know what I mean? You know this stuff. I'm going to go over a couple of highlight things, setting a stage, and I want to share with you some of my thinking, because you're the ones that have to do this. You're the ones that make the difference every day. And if I can offer some thoughts, some ideas that help you do that, inspire you in a very little way to get fired up in some regards. You know, it's always interesting with the elected officials, yeah, and I appreciate their efforts and so on, but I think ultimately it's about you. Ultimately, it's the people on the ground every day that make the difference in people's lives, and I thank you and commend you for that. I know you're all in it for the money, just like Wall Street. You know? It was after my 15th year, I was sharing this at dinner the other night, after my 15th year in dental public health, I broke the $25,000 a year mark. 15 years! That's why I'm 66 and still working. I mean, if I retire, I'm dead, you know? So I understand. I empathized. I practiced, I ran a dental clinic in a fishing village on the island of Jamaica where I was talking this morning, where I had to sharpen needles with a stone and boil them. I worked at a residential facility for the intellectually developmentally disabled in rural Connecticut, and there are rural parts of Connecticut, and it was great and changed my life. I was a Navy dentist, and so I got to see the military opportunities, and then just working in the community health center in Boston while I was getting my MPH at Harvard. So, you know, I've been doing it all my life. I love it. It's not work for us, is it? You know, we get paid, we do it, but that's why I commend you and I appreciate what you do. It really is a labor of love. I love what I do. I never aspired to be a dean of a dental school. It just happened. And I'll go through a little bit of that, and I want to share with you. I was hoping a couple of my graduates would be here today, Annie and Sarah. I don't know if they showed up. They said they might. So I've got 2 of my graduates from North Dakota that are here, and I've got other graduates, students in school from North Dakota. So we're providing public health dentists that understand public health here. I want to share rural America. I mean, 62, you know this stuff. You know, the thing that's really interesting is the uninsured thing. That's getting bigger. The residents over 65. You know, the fastest growing group of Americans are those over 80. And we've got to be aware of that. Many of us in our health education, we're used to working with young people. We've got to understand we're dealing with older people now. Things change. When it comes to oral health, when I was in dental school, everybody over 55 was going to have dentures. right? Now we got these people over 80, 85, and thanks to fluoride, thanks to sealants, thanks to oral hygiene, they're keeping their teeth and they're getting periodontal disease, they're getting other issues. We know there are associations with periodontal disease and systemic illness, not cause and effect, but there's a relationship, so we have to be very much aware of it. And I love it. I don't know, am I allowed to say? I'm going to say something here. I live in Arizona. We got these retirement communities, and I got these old geezers in their 80s, these guys. Thanks to Viagra, now they want veneers. They come in and says, I got Louise, she's a widow, lives down 2 houses down. Can you fix me up? I mean, it's a whole different world, right? I mean, in the old days, dentures, all right, give them, see what they do with the oatmeal. Now they got to look, they got to have a shade 22, they got to look, It's really funny. God bless, God, that's all I got to say. Rural folks, less likely than urban counterparts, you know what I mean? Less healthy. You guys have that issue. And it's really interesting that you got to deal with that. One of the things that the mental health disorders, it's funny because this is not the final draft, so I'm really going to have to wing it a little bit because I redid these and made them better, so I don't know. So this is going to be, we're both going to learn from this slide presentation, I'll tell you that. You just got to... I'm not into karaoke, but I might have to get into it. The mental illness stuff and the mental health stuff is the thing that I've come to realize over these last couple of years how important that is, and the substance abuse. People in rural communities abuse substances more than people in urban centers, which I didn't realize. There's a tremendous propensity for that. And now I know that 24% of the American population is at risk for substance abuse and mental illness. 24%. Now we've got all these people in this room, take 24%. I mean, that's a pretty real number. So I think we have to be aware of it. We don't have a lot of dentists in the room, do we? So you're the people, no, I don't see a lot of dentists. But I know, yeah, there you go. Good to see you again. So now I can really lay it out there. You're the ones that are going to have to be engaged in improving oral health. You're the ones that are going to have to be engaged in what I call integration and bringing the total health environment together. We've been fragmented for way too long. It's a thing that really bugs me as far as health insurance, and we'll see this. We know about the isolation. Poverty still continues to be the #1 predictor for poor health in this country. Period. And I think that's one of the things we see, higher levels of poverty. We know that there are a shortage of dental providers. Period. We're trying to change that. That's one of the reasons we started the school that we did in Arizona. There's a need for dentists, and dental hygienists in rural America, and they're not going. And I find it's not about the money. It's not about the money, because they can get paid. It's about this. It's about the people we pick to become in these professions that sort of get caught up in other things. We look at these community health centers and the lack of patients, the lack of care, and the amount of patients that they have to see. This is the thing too. Look, 3 million dental visits, 9 million altogether. Shortages in these vacancies. Look at the rural, 26% of rural health centers have vacancies of dentists. And they pay nice salaries. Again, it's not about the money. It's about picking a young man or woman that wants to go to a community health center, wants to have the heart, have the willingness to serve other people. And we'll talk a little bit about this. This is the one. Almost half of all rural health centers have had a vacancy dental position for 7 months or more. 1%. For those of you that are data-driven from the university, any epidemiology, 1%, you got a data slide. 1%. 1%. Only 1% of professionally active dentists in the United States dedicate their career to serve health center patients. 1%. That is not a number I am proud of as a dentist. That means 99% are not doing it. That's an issue. Maybe I got one of my graduates who wants to go to Williston. Well, hey, God bless. It's going to be great. Eric Allen, great young man. And so that's a good thing. Surgeon General's report on oral health. This is a big deal, and for the non-dental folks in the room, I would encourage you, go on the little website, look at the executive summary, because Dave Satcher and Caswell Evans, who was the author of this thing, did an extraordinary job of pulling together in very clear and succinct ways what this silent epidemic of poor oral health is in this country. And for those of you who are non-dental, day-to-day people, it gives you a great frame of reference to understand what these critical issues are. That oral diseases are common and consequential. They're linked to overall health. That was one of the realities we didn't realize. We just thought it was just about teeth. But the reality is not about teeth. The blood that goes to that periodontal sulcus by the tooth goes to your liver, your kidney, and your toes. That's why when someone is getting a liver transplant or someone is in kidney dialysis, someone is getting their knee done or their hip done, they have to have their dental checkup first. That's critical. And then when you overlay some of the more serious illness, HIV, hemophilia, it becomes even more pronounced. Disparities in health status based on poverty levels, rural areas, and minorities. It's still today, oral health, ladies and gentlemen, is the #1 unmet health need of any group. I don't care whether you're the elderly, I don't care if you're pediatric patients, I don't care if you're veterans, if you're women, if you're men, whatever group you want to segment, oral health disease is the #1 unmet health need. Every survey, you go to any nurse, you interview people, right? I mean, homeless people, what is it? I can't get a dentist, my toothache, this hurts, that hurts. Children, school nurses, it's still the #1 referral to the school nurses, toothache. Still #1 referral. You think kids can learn with toothaches? 51 million hours of time lost to school. And dental insurance is a joke. Can I say that? It's a joke. You know what it reminds me? When I was a kid, I used to put money in the bank, and they had a Christmas club at the savings bank. Anybody over 40, 50 may remember that, the old Christmas club. You put a couple of dollars in, and at the end of come Christmas, you get the money back, and you can buy your Christmas presents. It was a great thing. But that's the way dental insurance is. You put money in every month, and then when you're ready to use your dental benefit, you got a $1,000 cap, or you got to do this, you got to do that. It's like getting your own money back. It's not insurance. Insurance means things are at risk. And I still don't get it why we have health insurance and dental insurance. Hello? What's that about? Do we have nose insurance, ear insurance, finger insurance? I mean, it's the same freaking body. And mental health is completely out of there. We've sort of selectively dissected parts of the body out that are not included in insurance. You got to do something about that. You can do something about that. We're going to talk about that, I think, depending on these slides. They're not the slides I reviewed last night, went over, and I was so happy with. So funny. No good deed will go unpunished, and I don't care what the plan is. See, you got to improvise in life. That's what you learn. It's all okay. It's all okay. And the Medicaid, we cut Arizona. I'm so embarrassed. I didn't know the governor. I was in the governor's cabinet. I was the health secretary for 4.5 years for a governor. You know what I mean? And now I know the current governor. And it pisses me off. They cut the dental benefits of Medicaid. Give me a break. So now we got patients, and you know this. They're going to ERs, ORs. You think that's cheap? You think that saves money? That doesn't save money. Do a little sealant. Do a little fluoride varnish. Do a little education. Do some prevention. That's going to save you money. Don't take away the benefit for this. It's crazy. You're going to have to speak to these guys. I did this. I love these elected officials. I'll leave it at that. The workforce. Well, I want to see these guys. I'm not going to go into this. National Health Policy. We talked about policy. These National Health Policy Forum. That's a good website to check out every once in a while. The National Health Policy Forum is the unbiased advisor to Congress on health issues. They always do different things. They did one report on oral health, and it was pretty amazing. ADIA is the Dental Schools Association, and one of the things that they talked about at ADIA that was really interesting was that we have to give back. Dentists have to give back to society. Some dentists don't realize that even if they went to public school or private school to get their education, they receive public dollars. They owe us. I owe you. I owe society. We as healthcare providers are honored and given the privilege to take care of your health. It's a privilege. And we have a responsibility to give back. period. And I think sometimes we forget that part of our obligation as healthcare providers. Just across the river, I guess, or Chris Betos up in Canada, I know a Canadian when I hear the A and I would hear the word process. Right? Process. So funny. You live 60 miles away. Process. Okay. Good. I just get pissed off the money's worth so much now. But hey, I remember in the old days, it used to do pretty good. But nonetheless, Chris, in his study with his colleagues, found that, poverty and influence, why the poor do not have good oral health. Well, part of it is they have a tough time going to the dentist. Even when they can go, they feel bad. And there are a lot of dentists that feel weird having poor people come in and say, oh, they're going to steal my magazines. I don't make this up. So if you go in there and someone is looking at you, oh, are you the kind of person I want in my practice? It makes them feel bad. The shame. Terrible thing. So not only are individuals dealing with poverty, but they have the psychological self-esteem issues of being perceived negatively. And then they look at what, to me, attitude is everything. And one of the things that Chris found out in his study, and it's getting a lot of notoriety now, the work that he's done, is that people want straight police, they want to be employed. People don't hire people without teeth. People without legs get jobs before people without teeth. It's an interesting dynamic. When I see people with dentures, and I don't want to make fun of anybody in the room that may have dentures, but when you don't have teeth in your mouth, people perceive negative things. It's not fair, it's not right, but it happens. And I think we really need to work on that and understand the self-esteem issues of oral health. If you make dentures for someone, and I think every state, that's a good investment. If someone's on unemployment and doesn't have teeth, make them teeth. They'll get a job, get off the welfare, and they'll contribute taxes. They'll feel good about themselves. They'll take better care of themselves. I used to work in Calcutta for years for the World Bank, and I happened to be in Washington on one visit. I ran into Bob McNamara. Bob McNamara, he was president of the World Bank and defense secretary for Kennedy, and he said, who are you? I said, I'm Jack Dillenberg. What do you do? I'm doing public health in Calcutta. I said, do you mind if I tell you something, give you some advice, Dr. Dillenberg? I said, sure. He's a big, tall guy. I'm a little guy, Yes, sir. McNamara. Come on, it's a big deal. He says, you want to help people's health? You want to help them? Get them jobs. Get them employed. They'll feel good about themselves, they'll have income, they'll have self-esteem, they'll care about themselves, and they'll care about their families. I've never forgotten that. And he's absolutely right. And I want you to know how important it is for people to have a smile. How important it is for children in school to have a smile. When you see that child sitting in the classroom like this, right? They're in pain, they don't feel good about themselves, they're not going to participate, they're not going to reach out, they're not going to be creative, imaginative, innovative, and step up and make a difference, because they're going to just say, how am I going to get through the day with no one looking in my mouth? Understand how important that smile is. Understand as you do your work in your other areas how critically important it is to maintain the oral health. And then we've got the elderly. Fastest growing group, I said over 80. I'm 66, I've got a vested interest in this. And people are not ambulatory. They can't get out, they can't do things. And you know what really pisses me off? You're not going to tell anybody I said that, are you? There's no dental benefit in Medicare. How stupid is that? You think they save money on that? You think you got someone who's over 65, they invest their whole lives on going to the dentist, doing the dentistry. For some reason, when they're 68 years old, they have a stroke, they go into an assisted living facility where they don't have appropriate care from the oral health perspective. They're so overworked and underpaid, where they can't, all they do is brush the teeth when they can. And you got someone now developing periodontal disease. Within 18 months, all that beautiful dentistry, those teeth out. I've seen it so many times. It's tragic where you have someone that did all the work for the whole lifetime, invested in their dentistry, and then in the last, the golden years, come, here's my shovel. We're doing this to ourselves, ladies and gentlemen. We are, we've met the enemy, and we are it. We need you, all all of us collectively to make this difference, to work with our legislators and people to do it. This older population, we need to deal with the chronic diseases. You know, one of the things too, a dentist, you could be, you're in your office and all of a sudden someone comes in with a baggie full of 50 medications. You know, I admire the physicians. For the physicians and nurse practitioners, nurses in the room, my hat's off to you. I mean, the continuous education that you have to do to keep on top of the pharmacy stuff alone is extraordinary. To try to stay on top of this stuff, it's amazing. It's really tough. And then you have the patient that comes in with 4 dentures in the baggie. You know, hey. You know. What it requires is this, that we're all working together in this integrated model. And you know, it's no longer just this medical home. We need a systemic approach, and we'll talk about that. And I talk about the decreased dental insurance. Before I forget, Dietrich, here's the dental plan. You know, it's real. It's there. There's some creative stuff going on we could talk about. So we need this paradigm. We've all heard about primary care, comprehensive care, and now it's interprofessional care. That's the buzzword. You write your grants, interprofessional care, interprofessional education. We need to be working together. Physician assistants need to know about oral health in the medical office because we've got patients that we see in the dental office with periodontal disease that are at risk for diabetes. We got diabetic patients at risk for periodontal disease. We need to be talking to each other. We need to ultimately have one electronic health record that we all share. Isn't it ridiculous that dentists don't get to see medical records and physicians don't get to see dental records? Who came up with that crazy idea? It's all one, same body, same person, but they don't talk to each other. And now we're spending gazillion dollars to learn it. You were at the session yesterday, and we have to do that. We have to start to get better coordinated, more integrated to develop this in that kind of way. We need to change homes. We had a medical home. We had a dental home. What we need is a health home. You're going to see more and more of that term. It's not going to be a medical home. It's not going to be a dental home. It's got to be a health home that brings us all together. And the people that have been excluded, like I said, the dentists, you know, the physicians have been doing their great work, and they have nurse practitioners and PAs and stuff. Dentistry, we always had this cottage industry. Set up your shingle, practice. You don't even have to talk to a physician if you don't want to. That's got to change. We need to now have the behavioral health people. I'm going to talk about social work. Any social workers in the room? No, but they are pretty important people. Pretty important people. Because what I learned in starting a dental school and as a dental student, people come to dental schools, they have other issues than their teeth. They're poor, they're not in poor health, they're victims of domestic violence, the husband's an alcoholic, the son's shooting heroin, there's all sorts of stuff going on. And if all I'm doing is fixing that tooth, what am I doing? Am I a healthcare provider or a tooth technician? That was one of the mantras at the school that we created in Arizona. It's not about the tooth, it's about the person attached to the tooth. It's about the family attached to that person, and ultimately the community attached to that family. And every student at ASDO, the Arizona School of Dentistry and Oral Health, and we're the only dental school in the United States that has oral health in its name, interestingly, because ultimately it's about health, not about teeth. Every student graduates not only with their dental degree, but a certificate in public health. We also now have an online MPH, and this year out of 66 graduates, we're graduating 24 with a master's in public health. Largest dual degree granting dental school in the United States. Because we want to do that. We want to do that because I realize it's important. It's about leadership. We're going to talk about that. I'm going to give you my little guide to leadership, okay? Because you need to be leaders. You need to be. You may not want to be. You may not want to be, but you need to be. You need to be. The people in North Dakota are relying on you. You're the educated, caring individuals that are the health professionals that know better. You know what you need to do. But one of the things I've learned in life, too, that I'll share with you is knowing isn't enough. Do you think there's any smoker out there that thinks it's healthy for them, good for them to smoke? Huh? But they don't stop. We know we got to take that second piece of cheesecake and push it. I know, but Mom made it. Widman's was a challenge. That'd be tough. But the reality is, knowing isn't enough in life. You have to translate that into action. That's the challenge. You know, I say, one sit-up is 100% more than none. Right? Take it home. Think about that. Go for that walk. You know, we always like to get the best parking spot. Intentionally park further away so you get to walk. Intentionally. Oh, I'm not going to take that spot there. I'm going to go take the one 5 away so I can walk. Why? Because it's your body. It's your life. It's your opportunity to be healthy. And I got to tell you, ladies and gentlemen, we all need you to be healthy. You're trying to keep other people healthy, aren't you? That's your life. You're making a difference to people, but you've got to take care of yourselves. I'm not here to give anybody a hard time. You know yourselves. You know what you can do, what you can't do. Don't be afraid. I learned too in life, and I'll talk about this, courage is an important thing, and part of that is for each of us to identify these things that we need to do so that we can be doing better, so that we can be healthier as we go forward. It's important. Just like dental floss. Dental flossing is more important than brushing. Okay? Dental flossing is more important than brushing. I'm not going to ask how many people floss their teeth today. Sometimes I do that in the dental meeting, and you'd be amazing that 80% of the people don't raise their hands. Flossing is more important. I used to have patients when I practiced, you know, in the islands. And I said, do I really need to use dental floss? I said, no, you don't have to use dental floss. But I said, you know, only floss the teeth you want to keep. You know? That's all I have to say. You're bright people. I mean, the thing of it is we know. But again, knowing isn't enough. You have to step up to yourself. You have to, you know, and it's not easy. I'm not saying this stuff is easy. Come on. The thing I've learned about myself, being this short, bald, bearded guy, I've learned to handle rejection very well and humility and stuff. And we sort of, you know, you just got to do it. These are the things in this health home. It's got to be accessible, continuous, comprehensive, family-centered core. You know this. Compassionate is really a critical piece. Compassion. Compassion. I want to produce caring, compassionate healthcare providers. They're the ones you want to go to, the Marcus Welbys, the ones that you remember, the ones that are going to make a difference, that ask that extra question, sit down with you and ask how the kids are doing, how the grandkids doing. The one that cares about you as a human being and not just I got 7 minutes to do what I got to do with you, and I'll see you later. And who's your insurance carrier? You know. And remember this interprofessional thing. Alan Finkelstein, one of my buddies, one of the brightest men I know in dentistry. He was the National Dental Director for AmeriChoice United Healthcare. I love this. Dentists are not the optimal provider of intensive disease management service. Lower cost cognitive disciplines such as social workers, health educators. You know, and he came up with a thing, genius. Genius. You know, we'll talk about it. You get to see the medical and dental is, again, the health home of the future. And this health home, what he did, and it may come up later because these slides are, I can't believe I got the wrong slides here. We took the wrong one off the drive. And I apologize because the ones I got are pretty, there may be one or two fun ones still in here, we'll see. But I don't think so. I apologize. Now you're stuck with me live. See, now you got to just listen to my caca. You know what I mean? Is it okay? You staying awake?
Yes.
Okay, good. Okay, good. Just, you know. The thing that he did that I thought was real interesting, babies get to see their pediatricians 7 times more than they get to see their dentist, you know, before the age of, for wellness exams, right? You're a mom, you got a baby, you got to go make sure the baby's okay, blah, 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 whether you want the immunization or not, we can talk, that's another story, but you got to get in for your well baby thing. See, the pediatrician gets to see this kid. You don't go to the dentist, people don't think, oh, it's only baby teeth. They don't realize the baby teeth are the guides for the permanent teeth. Whatever it may be, they don't go to the dentist with a 1-year-old, a 2-year-old, a 3-year-old, a 4-year-old, maybe 5. And if there's no pediatric dentist, maybe 6. But nonetheless, what Alan came up with, he says, I'm going to do something. If that pediatrician refers that baby to a dentist, I'm going to give him $15. So now all of a sudden, really? If I refer that kid to Dr. Smith down the street, you'll give me $15 for the referral? Yep. And if they show up, I may give you even more. So here we now have got a United Health doing this where they have the physicians referring to the dentist and they get paid for it and they follow up. So now the medical office is calling, Mrs. Jones, did you get to see the dentist yet? If we do what we're reimbursed to do as healthcare providers. That's Mother Nature. That's the way it is. And it's real. I'm a capitalist. That's the world we're in. So reimburse someone for a service that's going to improve health. And I know that United Healthcare is saving money in the ER and OR. I mean, why do you think you pay $20 for a Q-tip when you go to the hospital? It's because of the uncompensated care. So if we can cut down the uncompensated care by doing some reasonable, preventive-oriented, integrated, interprofessional care, we save money, have healthier kids, and everybody wins. And we got to do that, you know, with the physicians now. In the barriers for these primary care docs, oral health's not there. You know, a physician in the room, you know, any physician, the only oral health I know physicians had when they were in medical school is the eruption pattern of teeth. One lecture. 6-year molars. Oh yeah, they come in when the kid's 6 years old. Oh, that's very good. That's what they learn. The physicians go from the lips, and then they don't pick up again until the tonsils. Dentists barely look at the lips, and they stop before the tonsils. You know, this is not comprehensive, holistic, total person health care that I think is advantageous. We need to do a better job, and we have the opportunity to do that. They're busy. Oral health is not a priority. Confusion about their role, and the lack of training, and the reimbursement is absent. Well, I think there's creative opportunities to do that. We're starting to see some more of that. Who's got to do it? The healthcare system, executives, health profession school deans like me, but like here, you've got PA, PT. You know, I wrote an article with Randy Danielson a couple of years ago that we put in the PA Journal, developing oral health competencies for physician assistants. They loved it. We did a survey of physician assistants, and they said, we don't know about oral health, but we think we need to. They're ready, willing, and able. So you need to talk to the folks at UND at their health, whether it be the nursing, the PA, whatever program there, and say, what are you doing about oral health? What can we do to collaborate? How can we work together? It's all about working together, and not this isolated stove, you know, pipe kind of thing where you've got the dentists, the physicians, and everybody just talking amongst themselves. You're the ones that need to be able to do this. You know, I expect dentists and hygienists to be talking about teeth. You're the folks that I want to win. You're the folks that have that opportunity. You're the ones that relate to these patients on all sorts of levels. Nutritionist? You're the nutrition guy, right? I remember you. 4, right, in your section? Yes. So I told a couple of dentists yesterday, start an oral health section for the North Dakota Public Health Association. We need an oral health section. I love policy. It's critical. I love having the opportunity to steer the boat, not just row the boat. That's the difference. When you get involved with policy, when you get engaged in your organization, whether it be the Rural Health Organization or the APHA link to North Dakota, you know, that's when you get a chance. I've been the president of 2 national organizations, and I found that's when you have a chance to really develop policy and make a difference that's long-standing, that's lasting. You've got that opportunity. You really and truly do. And I encourage you to do that. Integrated provider. Here again, this is the thing too. We need a medical and dental program, and we got to have the behavioral health piece in there as well. You know, the reimbursement. I talked a little bit about that. The behavioral health piece is the one it's really missing significantly, and we've got to do a better job. See, I got 5. This is the thing too. Tooth decay is 5 times more common than asthma in children. Think of that. Asthma, everybody talks about. Asthma doesn't stop people, doesn't cause pain. Asthma doesn't create a cripple for the rest of their life dentally if they lose their teeth. Baby bottle tooth decay, you know what I'm talking about. Early childhood caries. Then you got methamphetamine, the drugs. Meth mouth. I mean, it's unbelievable, the substance abuse stuff, the deterioration. And here's the thing, 40 to 50% of children in this country have dental decay by the age of 5. That's staggering, especially when we consider we've had fluoridation, we're using sealants, we've got all these interventions, but still we're getting tooth decay. It's not going away, and then you got the older population on the other side getting the periodontal disease. So there's a lot of dental disease out there. We got to stop it. You can stop it in a whole host of ways. The primary care physician, again, 7 times an hour. I told you this. Boy, these slides. Oh, I don't want this stuff. Oh, I wish I could do the competencies. Social workers, we talked about that. Social workers are heroes. I love social workers. I attended a meeting at the dental school's meeting and found out the University of Buffalo Dental School has social workers working on their clinic floor. That was an epiphany for me. So I stole that idea. And we do it in Arizona, social work in a dental school setting. Because people come in with these other issues, and now we have a behavioral health provider down the street, so they get the issue, we do them a screening, and we send them to the behavioral health provider. It's a tremendous opportunity to help people be healthy. Everything changes. You know, this was our idea, this is what I talked about. Economic market forces, societal pressures, and professional self-interest must not compromise the contract the oral health provider has with society. That's a policy in the dental school's handbook. We have an obligation. We forget that. And we do because all of us as dentists have been helped. I love this guy, you know, back in the Dakota territory. He said, it's not what we have that will make us a great nation, it's the way in which we use it. We've got the answers here. This is not something that we're waiting for someone in yellow robes to come down off a mountain. We've got it. Now we just got to be creative and use it, not be afraid to use it. We talked about the oral health. We know the links to all these different issues that we have to address. I got fingers. See, it's back again. See, this, that's why I edited this. I am so sorry that I don't have the really fun stuff. I wish I had my thing. You know, special care. This is something near and dear to me. The most underserved group of individuals in the healthcare system are those with intellectual developmental disabilities. I don't know what you do for Special Olympics up here, but I certainly encourage you doing it. It's the most rewarding thing I get to do. We started a special care clinic in our dental school, and we're the largest provider in the Southwest for special care dentistry. Autistic, Down syndrome, whatever it may be, all these different types of illnesses. And it all starts with leadership. And I think that's one of the things I want you to be aware of too, this servant leadership model, where we sort of, you know, compassionate, humble. You know, I like to, you know, I've got confidence. Again, you know, when you're short, bald, bearded, and rejected a lot by the chicks when I was in high school, I could, you know, I had to, you know, get a thick skin and say, okay, and I've succeeded in things, so I'm confident, but I don't want to ever not be humble. Arrogance is not a good thing. Arrogance is not a good thing. You got to be humble in life. Everyone has a story. No, we're all in this together. We all bleed red. We're all in this together. I think humble leadership that's respectful and caring is so important. Service, humility. Here's the thing about leadership. Confidence builds effective leaders. Confidence. This is my yin-yang slide, I think. It's not only the confidence of the cat, but think of the discipline of these dogs. So you learn in life, you got to have the confidence, you got to have the discipline. That one sit-up a day, pushing away the cheesecake, don't light up the cigarette. Whatever you define that, you got to do it. You got to do it. You've got to do it for yourself. Your clients, your patients, your spouses, your children are relying on you to be healthy and happy. Happiness is important. One of my heroes is a physician, his name was Albert Schweitzer. He did a lot of humanitarian work in Africa. Really, he was a hero to many of us in the health field. He used to have a little plaque on his desk that said, success doesn't bring happiness, happiness brings success. Do what makes you happy. Do what makes you happy and you will be successful. Come to work as joy. I do. I mean, I don't want the president of the university to know how much fun I'm having because he's going to cut my pay. So nobody talk. Taking the cone of silence, you know. The future of our profession is not what we expect in terms of the people. Everybody thinks that the ideal physician and dentist is going to show up and be in their white shirt and tie and dark suit. That's what I get them at interviews, and I tell them, you know, that's ridiculous. I wish I could open up a Interviews or Us franchise at airports. When students come for their interviews, they can leave their flip-flops and tank tops there, come in, put on their white shirts, ties, and stuff, do their interview, and leave, because I never see them in it again. It's a joke. I tease them all the time about this. But the student of the future is this. And I think the thing we need to recognize is that this could be the greatest healer, planner, leader that we know. And I think we have to recognize that it's not what we expect in this format of preconceived ideas. We started this dental school, and the leadership is an important piece of it. We want to educate caring, technologically adept dentists to become community leaders in serving those in need. And one of the things that I learned that we do differently than every other school is how we pick our students. Once you have above a minimum academic standard, the #1 criteria for getting into our school is community service. Community service. The average number of hours of community service one of our students that we accept has is 700 hours of community service before they show up. 700. That's huge. Huge. And they're the most extraordinary men and women I've ever met in my life. This year we had 3,600 applicants for 76 spots. This little school in Arizona, we have more applicants than any dental school per seat than in the United States. More than Harvard, more than Michigan, more than Minnesota. We take a lot. In one class, I had 6 or 7 from Montana. There were 10% of our class were from Montana. And I said, you're going to go back and be 10% of the State Dental Society. It was a riot. And then our, North Dakota, Annie Wilson here and Sarah from North Dakota. We have one more now. I can't remember at school. Casey? Casey Blair. Casey Blair, thank you. You've met our students. Anybody met our students on rotations or anything? Somehow I knew. No, they're extraordinary. You're going to love them. You're going to want them. And I'm opening a second school in Missouri with a rural health model that I hope is going to have implications for North Dakota, South Dakota, Idaho, Wyoming, Montana, where we can pick a couple of students from the states here, come to Kirksville for a couple of years, then come back here to a community health center, maybe in Bismarck that's big, can handle it. We're working on the details of the model over this next year or two, but I know it's going to work. I know it's going to be important, particularly for providing rural dentists from hometowns. Because that's what you want. I want you to have a North Dakota kid that's here. And I say kids, I apologize. They're young men and women. And even young, I shouldn't say. 4 years ago, we took 2 gentlemen that were 48 years old to start dental school. People say, why would you take someone 48? I said, they're going to graduate at 52. They got 20 years to give back. Right? One's graduate, is MPH. He's a dental director of a community health center up in northern Wisconsin there, Marshfield. I got another one doing another dental director somewhere. We produce a lot of dental directors. This year we're graduating 66 students, 24 of them, I tell you, have the MPH degree. Unbelievable. 36 of them applied to residency, specialty training, 35 matched. That's so far off the charts, I had to go to the ADA headquarters in Chicago. They said, how did you do this? We've never seen this before. So here's the nation's public health dental school, this little school in Mesa, Arizona, that now it's capped at 76 students, is producing dental leaders that are working community health. I'm going to show you, I hope I have this slide I can show you. Our rotations are one of the things that does it. We send our students away for half the 4th year. You're asking me about community, having to pay. Most dental schools can't do this. They want to send to a community health center, and they ask the community health center to pay for the student to come. I let the community health center keep the money that our students make. But they got to provide the housing. I remember the first one I talked to, time-wise we're okay? You doing all right? I don't want to, my timekeeper. It's bad when your timekeeper falls asleep, you know what I mean? Holy mackerel. Everybody okay? Okay. Anyway, so you're really getting me. So you're getting the real me, you're not getting the slides, which is good. I said there's no correlation to the slides. It's pretty funny. So I owe you one. I'll come back on the house and just with the slides, with the cartoons, if you so desire. We also took a young woman, I wanted to say. We took the 2 guys, 48. Took a young woman 3 years ago that was 16 years old to start dental school. 16 years old, graduated Berkeley with a 4.0. Little Doogie Howser. Unbelievable. She can't even graduate. I can't even practice. I got to keep her for a year in a residency because she can't get a license until she's 21. It's a riot. And not one of our first-year faculty identified her as the youngest person in the class. Very poised, polished. She's an officer in our American Student Dental Association chapter, and she's darling. And it's great. Her patients love her. It's just great. This 4th year, so we send these students away. So I remember calling up Carlos. He's the CEO of the Community Health Center in Yakima, Washington. Apple growing and picking community. A lot of migrant farm workers working there. Beautiful community health center. And I said, Carlos, he said, yeah, I love to have one of your students. I said, you got to house them. I said, He said, I'm not going to house your student. No, you got to house him. And I'll let you keep the money the student produces. He said, really? He said, yeah. And if you pay for the housing for a month, and you keep the revenue, and if you come up short, I'll give you the difference in cash. He never called me. They love it. Our students are very productive. We have an innovative model that we've created that's unique, that's being replicated by other dental schools now on how we train these students. They spend that time in clinics. They generate $10,000 to $12,000 in the month they're there. These are fourth-year dental students. So I figure, how much do you think it costs to rent an apartment for a month in Yakima? He's doing all right. I'm a Queens boy, remember? You know, hey, I get the boys to talk to you, Carlos, you know. You know? It was funny. Last week I'm speaking to the Jersey Dental Association. It's not New Jersey. It was the island of Jersey in England. And it was funny because they were talking about New Jersey. They said, oh, they took me to a plaque with the guy who founded New Jersey. He was there. I have to show that to some of my buddies in Newark. But it's just funny, the world, Jersey. Okay, so the students are doing all these things. They're getting real-world experience. We created a model. We have over 60 sites throughout the United States, from Ellsworth, Maine to Yakima, North Dakota, Montana. They're going all over the place. I've got 68 sites throughout the United States that have our students come to for a month at a time to do dentistry. I'd love to have more in North Dakota. I'd love to do more with North Dakota. One of my goals, ladies and gentlemen, with this model we're creating in Missouri, and I hired the most incredible dean for this school. I love this man. His name is Chris Halliday, Dr. Chris Halliday, not related to Doc Holliday, you know, from Tombstone, Arizona, whose grave I saw on Boot Hill. But Chris Halliday is right now today the Chief of Staff to the Surgeon General of the United States. He's got a couple of stars up here. He's a dentist. He was the Chief Dental Officer of the U.S. Public Health Service. Prior to that, he was the Chief Dental Officer for IHS. You remember Chris? I mean, what a guy. I mean, you don't get a higher quality guy than this. You know, I say he's just like me, except he's taller, better looking, and younger. But aside from that, we're just very similar. But nonetheless, he's going to be the dean of this Missouri school. And what I want to do is create this group of public health-oriented dental school administrators that we can then develop the policy, drive the educational models that are going to produce the dentists that are going to have the caring, compassionate leadership skills and nature to come to rural communities and make that difference. You know, you're very lucky in North Dakota for a lot of reasons. One is your dental director. I saw come in. Kimberly, where are you? Kimberly, wave, will you? There, Kimberly Yineman from the North Dakota Health Department in Bismarck. You know, ounce for ounce, she's the most effective dental director in the United States. If she weighs 98 pounds dripping wet, I'd be surprised. But nonetheless, she's innovative, hardworking, and has the heart of an angel for caring for the state. Again, we got to set up an oral health section for the North Dakota Public Health Association. Nutrition guys, why don't you talk to these dental folks and show them how you can do it with a small number and be effective and do it, all right? See, you see, I paid attention, you know? Okay, here's where they are. I mean, Alaska. I send students to inside the Arctic Circle working on Eskimo kids. You think it's rough? You think winter's rough in North Dakota? No. They use pallets as boardwalks to walk because the mud is so bad to get from place to place. I went to a village that was 300 miles from the nearest village. And I mean, unbelievable what these people do for life. It's very hard. It's a hard life up there. And so we have students. I have a number of Alaskan students. I love taking students from places that don't have dental schools, that are unusual backgrounds, that are community service oriented. We have half the class is women. We have every ethnic group there. From all over the place. Our certificate in public health. This is big. All of our students take these courses. I want them to go to a community and know the epidemiology, to call up the state health department, speak to the medical director, say, hey, what's going on? I see we got some high numbers here in this. What can I do to help? How am I an effective leader to make a difference with people's lives? And so on. Our hometown project. If your community health center has a student that you love, that you want to come back and be a dentist here, you let us know. I told you we get 3,600 applicants. If we get a letter from a community health center and say, I love Judy, she's just a wonderful gal, she volunteers here, she's great, she'll be a great dentist, I know she's going to come back, you know, to Minot and work here and help us, Judy gets an interview. That takes her from 3,600 to 400. I try to take as many hometown, what we call hometown applicants, as we can, because they're the ones that are going to make the difference. They're the ones with the caring capacity. They're the ones with the link to the community. They're the ones with the understanding of rural America that appreciate it, love it, and want to be here and be part of the success and part of maintaining that health and wellness in rural America. So we can do that. Our graduates, 78% of our graduates serve underserved patients. There is no dental school that, I mean, is close. And that's nothing bad. 94%, we surveyed them, said that we prepared them to treat these disadvantaged. This was the one I really liked too, that 83% of our graduates strongly agree that we prepared them to treat patients with disabilities. Every one of our students is required to go through a special care clinic. Other schools, they take lectures. And 4 schools in the country have electives, but we require it. And here's your data slide. Okay, where are the epidemic? Get ready. You taking notes on this slide? 36% of our graduates are working in a community setting. Prior to our school, the highest number was 8. We are doing it. People look and say, how the heck are you doing this? You do it because you love your students into being great doctors. We're the first dental school without tenure. I got faculty that love to be there, that love the students. You know, they care about that. It's an extraordinary place, and I hope if ever you get to be a snowbird and come down and want to whack little white spheroids in the warmth of Arizona, you come by and visit us and say hi, you know, when you're down there visiting your grandfather or something, you know what I mean? Patient center, we talked about this. See, oh, these are primary, I don't want to go through all this. You know this stuff. Payment reform. How are we doing on, I am so disappointed. I worked so hard on that new presentation. I don't understand why this one got loaded up. 5 minutes, I got 5 minutes. There you go. Let me see if we get back, let's fly through here. Again, we talked about this health home. It's got to be the combination, and you've got to have your providers working together. There's got to be the link. I don't know what it's going to be. In dentistry, we have the M word, mid-level provider. You want to get a dentist upset? You want to get organized dentistry upset? Say you're thinking about mid-level provider, doing a program in North Dakota. You know, they don't get it. Physicians can't live without their PAs anymore. They can't live without nurse practitioners. Dentists back in the 60s were opposed to hygienists. They said, I'm not going to have a woman in my office do the prophies. I'm going to do the prophies. When was the last time your dentist cleaned your teeth? Come on. You know, it's a shame. Oh, golly, Jack, you're so stupid. And I thought I was pretty cool. You know, I did it. I have it on my little thumb drive. I put the thumb drive in there, and somehow the other wrong one got on there. You know, no good deed will collaborate. I'll tell you one fun thing. I have a great slide on collaboration. The word collaboration, that's what it's about with all of you here. You know, collaboration, work together, right? I define it differently. Why not? I can. You know, col, C-O-L. The col is the space between 2 mountains in the Alps. If you want to build a bridge, and I have a slide, a real fun slide that shows this. If you want to build a bridge between these 2 peaks, you got to work together, labor, and you got to talk together. Oration. Col, labor, oration. Collaboration. You can use that. Col. Check it out. Because that's what it's ultimately about. We're all in this together, and no one's better, no one's more important. We all have something to contribute. I think the important thing is not to be afraid. I tell my students, for a turtle to go forward, he's got to stick his neck out. Don't be afraid. Leadership it requires courage. And I'm not saying be frivolous. I'm not saying do stupid things. Don't buy stocks that, you know, don't be a day trader or whatever. Be smart, but be courageous. Because ultimately in life, you will regret the things you didn't do, not the things you did do. You'll regret the things you didn't do, not the things you did do. Don't be afraid. Don't be afraid to take the risk. It's worth it. And people are counting on you. So again, the collaboration with these programs. You know, you're all in different programs. Make sure that you're talking to each other, that you're respecting each other, that you're integrating these programs. And integrate oral health. It doesn't take a lot to do that. And promote leadership skills. That is critical. The confidence, the competence. And it's all about teamwork. You know, we got to be working together. I admire the fact that you're all together at this meeting. I appreciate that you all showed up here today and that you understand that. You care about your communities. You care about this state. There's some great, I think there's great opportunity. This healthcare reform stuff, we'll see what the Supreme Court does, but I think ultimately they're going to have to pass some of it. If they don't, it'll be the biggest mistake. You know, and I don't care whether you're an R or a D, but it's going to be a good thing. And if things work out, then we're going to have health. And I'll give you the 12 warning signs of good health. You're going to have regular flare-ups of supportive network of friends and family. It happens when you're healthy. Just be aware. You're going to have chronic positive expectations. You're going to have repeated episodes of gratitude and generosity. Generosity is a good thing. Be a good tipper. You know, Deepak Chopra told me that once. He says, when you get money, pass it on. The more you get and pass on, the more you get. Don't stop the flow. That's why I shop so much. I try to tell that to my fiance. It doesn't work, but nonetheless. Increased appetite for physical activity. Don't be afraid. You know, I can touch my toes. You know, it's how you define it, but do it. Do something. Walk. Do something. Pushing cheesecake away, you know, the best exercise you do is push yourself away from the table. You know what I mean? You got to do something for yourselves because people are counting on you. You need to do it for yourselves, your families, the clients you serve. Be healthy. Take care of yourselves. Honor yourselves. Really. You need to be healthy first. And then with good health, you'll have a marked tendency to identify and express feelings. Be in touch with yourself. Compulsion to contribute to society. Stop, I gotta stop. Okay, lingering sensitivity feelings. And we'll go fly this in 30 seconds. Cravings for, and I love the very last one, spiritual involvement, whatever you define that to be. I pray every morning to who's ever listening. I don't know who's in charge. I say, thank you, who's ever in charge. I hope she's benevolent. And have a persistent sense of humor. Humor is important in life. You know, life is so serious, things go on, but you gotta, you know, be happy, be joyous, have fun. And then the 1%, we told her, 5 million people visit the Grand Canyon every year. 95% of the visitors arrive at a bus or train, they stay up there, get impressed, buy a souvenir, and leave in 2.5 hours. 5% of the visitors just make a trip just below the rim. It's only 1% ever make the effort to go to the river and discover it's a pretty spectacular place to be. Only 1%. So the access to care problem will not be helped simply by graduating more dentists or physicians that go where 99% of everybody else is gone. We need more 1%ers. Those who are willing to go where the others won't and find out it's a pretty spectacular place. Thank you very much for your time. Thank you so very much. Thank you.